Let's look at how overbreathing can cause such significant problems. Suppose everything's normal and then some stress comes along. Say you're on your way to an important meeting and you get stuck in a traffic jam or the car breaks down or something. The stress triggers increased breathing. Your breath speeds up and maybe each breath is bigger. In consequence, the carbon dioxide that's dissolved in your blood starts to drop because you've started to breathe it out at a faster rate than your body makes more. Blood concentration of carbon dioxide is actually the key thing. Lowering it causes the blood to become more alkaline or less acid. That's because CO2 is the main determinant of blood acidity. And that's actually quite serious because the body needs to keep the blood pH within strict bounds if it's to function effectively. So even when it drifts a little, there are consequences. And I want to focus on two. First, the blood vessels in the brain especially, but elsewhere in the body to some extent, constrict, and this reduces the blood flow. Second, the blood holds on more tightly to its oxygen and doesn't release it to the cells that need it. These two effects combine to reduce oxygen delivery to brain cells, in extreme cases by as much as 60%, that's 60%. It's really a problem because it's easy to get stuck in a vicious cycle of worsening breathing, where the brain's automatic regulation of breathing is effectively broken. The brain detects the problem as a build-up of CO2 in the brain itself, and it increases the feeling that you need to breathe more. It feels like you're not getting enough oxygen, and that's literally true in terms of the brain, but of course the blood has plenty of oxygen. Your lungs are getting plenty in, it's just that the oxygen isn't getting out of the blood and into the brain cells where it's needed. So then you breathe harder, making the problem worse, not better. So this is exactly what happens in a classic panic attack involving hyperventilation. The less oxygen the brain gets, the more the feeling of panic intensifies until something happens to break the chain reaction. Now, if the overbreathing goes on for long enough, and I'm talking maybe as little as just a few hours, then the body starts to adapt, as I mentioned before, to this new lower baseline of carbon dioxide. We don't need to go into the details, but the body makes some adjustments so that the blood pH is returned to the normal range. But the problem is that comes at a cost in the form of the chronic symptoms that we listed earlier, such as fatigue, that you probably wouldn't have guessed have anything to do with breathing. Another consequence is that now the body has much less resilience to further changes, meaning that future stress can tip you into anxiety and even panic much more easily.